Welcome back to Smitty's Learning Room. Today we continue having a look at the HSC Core Sports Medicine, and we're going to have a look at the assessment of injuries, specifically TOTAPS. So we look down the syllabus and we look at the focus question today: how are sports injuries classified and managed? So we've already had a look at how injuries are classified, and we've had a look a little bit closer at the management of soft and hard tissue injuries. And today we're having a look at the assessment of injuries. So how do we actually assess an athlete for an injury? And this is where this concept of the acronym TOTAPS comes in, which stands for talk, observe, touch, active and passive movement, and a skills test. So this video explores the concept of TOTAPS, why we need to use it, and how do we use it, what do we use it for. So to start by having a look at the assessment of injuries, we need to assess injuries in order for us to work out what type of treatment. So we already know that from having a look at the treatment of hard and soft tissue injuries. But when an injury occurs on the sporting field or at training, it's important to start by doing doctors A, B, C, D, and then that allows us to begin the assessment of the injury process. Life-threatening or serious injuries will require medical assistance, and for less serious injuries, a sports practitioner can apply first aid. Now, depending on that type of injury, the athlete may or may not be able to play or continue playing or continue participating, and may need to seek medical advice. So if there is an injury that has happened or that occurs during training or play, the thing that we need to do is to apply the STOP acronym. And so STOP being S for stop the injured athlete and the game if necessary. T, to talk to the injured athlete and ask them what happened, where does it hurt. O, observe the injured area for any deformities, if there's anything obviously broken or any obvious soft tissue damage or bruising. And P, prevent any further damage. We conduct a further assessment called TOTAPS. And so these are some pretty obvious things that we do, and when an injury happens straight away, we apply this STOP process, and then once we've applied that and we're all clear, we sort of then go into the prevent stage, which is where we have this much deeper assessment of injury, which is called TOTAPS. So let's have a look at what TOTAPS actually stands for. So we have the TOTAPS, the T being talk, the O observe, T for touch, A for active movement, P for passive movement, and then S for skills test. Now the remainder of the video, we're actually going to talk you through each step and have a look at what sort of things the practitioner would ask at each stage and how this actually enhances our assessment of the injuries. So this first stage, talking. So the reason we talk to the athlete is to gain a better understanding of the injured athlete, and to actually try and work out what sort of injury has occurred or what's actually happened to cause this injury. And the sorts of questions that a sports practitioner may ask are: what happened? Where does it hurt? Did you hear anything? That's usually in relation to maybe a bone breaking perhaps, or if they've hit their head. And have you had this type of injury before? So these sorts of questions are going to be able to allow the practitioner to begin to make some sort of judgment as to what sort of injury or to the extent that they've been injured. The next part is observe, and this is where the practitioner observes the body part. So for example, a netballer's gone down with a sore knee, and they may compare it with other body parts to note swelling or deformities. So for example, if that knee's been injured, they can then say, I'm just going to have compare your left knee to your right knee. And often this is a way for us to see if there's actually a true deformity there or any swelling or anything like that when we compare it or observe it with another body part. Now, if a fracture is identified at this stage, it's really important to stop TOTAPS and manage the fracture as a hard tissue injury. If you continue through the TOTAPS process where fracture is evident at the observe stage, it will most certainly cause further damage or further injury to the athlete. The next stage is touch. And practitioners need to be careful with this one, and they need to make sure they seek permission to touch the athlete prior to this stage. And basically what they're doing is examining the injured body part, and they're sort of just conducting a bit of a search on the body part by having a look at how much pain is present if the body part's touched. So you can do this by looking at a pain scale. For example, on a scale of 1 to 10, how much does this hurt when I touch this area here? Now, obviously, the practitioner will start by applying pain away from the site. So back to our knee example, if you've got knee pain, they might start at the ankle and sort of work their way up closer. And this allows them to identify the point of pain. If we can identify the point of pain, we can then try to work out whether, is it a hard tissue or a soft tissue injury. Now, if a hard or a soft tissue injury is suspected at this stage, at the touch stage, we need to stop again, and that's where we refer to the injury management. So obviously soft tissue injuries would be managed by RISA. Hard tissue injuries would be managed depending on the type of hard tissue, whether it's a fracture or whether it's a compound fracture. So if the athlete's gone through the talk, the observe and the touch stage with no pain, that's when we move to the active movement stage. And this is where the injured athlete will try to move the injured body part until it becomes painful. So back to our knee example, the practitioner will ask the athlete to bend the knee, move the knee, can you put any weight on it? Is there pain? If there's no pain, then obviously we can continue through to the next stage. But if there is pain, you need to stop the toe taps and treat as a soft tissue injury. So obviously we're not treating as a hard tissue injury, because by this stage, after the touch, we would have already identified if it was a hard tissue injury. So we would have identified in the previous stage. So by the time we get to active movement, this is where we're testing for soft tissue injury or being able to return to play. So if an athlete clears active movement, we then move into the stage of passive movement. And this stage is carried out if there's no pain, all right? So make sure that there's no pain in the active stage, then we move to the passive stage. And the aim of this stage is for the practitioner to move the injured body part through the normal range of motion. So bending it, like extending, flexing it, applying pressure to it, to see if the athlete is actually experiencing some pain when a bit of force is applied. Now, if there is pain present at this stage, stop toe taps and treat as a soft tissue injury. If there's no pain, then we move on to the next process, the skills test. Now, the skills test is the final stage of toe taps. So we've got through all the stages pain-free, and we're ready to see if the athlete can actually perform skills which are similar to which they will be required to perform within their game or their performance. And if they're yet to experience pain, we put them through what we call a skills test. So for example, here in our example here, we've got some cones where we would get an athlete to dribble a ball around, change direction before shooting at a goal to see if that actually causes pain to the area. Now, if no pain is experienced during the skills test, then it's up to the practitioner and the player to make the decision as to whether they'll return. Most often, it's if there's no pain experienced in the skills test, the athlete will return to play. If pain is present during the skills test, you need to stop and treat as a soft tissue injury. So once they get to the skills test, if they have been clear of pain all the way through, but then they're experiencing pain at the skills test, they actually need to stop and treat it as a soft tissue injury. So just bringing all of this together, the reason we apply this toe taps is to help us identify what type of injuries they are and to assess the injuries and the severity of the injuries. Because sometimes an athlete might have an indirect injury where they've sort of hurt their knee, but it could just be for a short period of time, and in time, once they go through a skills test and through passive and active movement, they might actually be okay to return to play. So it's really important to apply this concept. Obviously, the talk and the observe stage is something that may already be carried out when the practitioner is doing doctors A, B, C, D. And so it's really the touch, the active movement, passive movement, and skill test, which is important. It's still important to talk to the athlete to try and understand whether a direct force had impact, or whether it was an indirect force, whether this is an acute injury or perhaps it's something that happened before and it could be of an overuse injury. So this is a really important strategy to implement to help us assess injuries so that we can treat them effectively and allow athletes to recover properly to return to play in ample time.